Today I'm going to share my cancer removal surgery with you. Here's my scar. I'm Sean, I'm a melanoma mom, and I was diagnosed with melanoma skin cancer in January of 2021. If you want to hear that diagnostic story, I do have a video about it. I will link it in the description box of this video, so go watch that video first. If you're interested in knowing about the surgery aspect of it, then that's what this video is about. I have created this channel because I'm hoping to give more real-life stories. There are not that many out on YouTube, so I thought be nice to have a channel where I do sun protective sunscreen reviews, UPF clothing reviews, and share stories about my melanoma journey. Here is my wide local excision. That is the surgery that I had. So after I was diagnosed with melanoma skin cancer, it was about a month till I actually had the surgery. I met with a surgical oncologist about 2 weeks after my diagnosis. He is a melanoma specialist. He looked at the spot. Well, actually the spot was kind of gone because the biopsy that the dermatologist had done was there. And he looked at the pathology reports and he said, okay, we have to do a wide local excision because the spot is 0.37 millimeters surface spreading. It's a T1A. So it's a Clark level 1 superficial spreading, not that big. It was about a little bit smaller than a pencil eraser. It was darker than all my other spots. Very scary. I've never had surgery before. This is my first big surgery. I take it back. I did have my wisdom teeth out when I was a teenager. But other than that, I hadn't really had any surgeries. So it was emotional. But the procedure could be done in one day. I had pre-screening a couple of days before with the hospital. I also had to pay my hospital bill up front before I could even get the surgery done, which was horrible. It was expensive. It was over $2,000 to pay for the hospital visit, and it was only going to be a one day, not even a one day stay. It was like half a day. He said the procedure would take about 3 to 4 hours. So I drove. The hospital was like an hour and a half from my house. Drove a couple days before, did the pre-screening. They basically did blood work, full panel blood work on me. They asked me like a whole bunch of basic questions. I was probably only at the pre-screening for about 30 minutes. You know, they just want to check and make sure you're not allergic to anything. They want to make sure that you're healthy enough to go through the surgery. And then the day of the surgery, checked in, my husband dropped me off. This was during COVID. He was allowed to sit with me during, like right before they took me in, and then during the surgery he went back to his car to wait, and then they called him back in when I was done to take me home and the wake-up process. Before I went back for surgery, they gave me, my surgical oncologist had like evidently a whole cocktail of painkillers and antibiotics that were given to me, some through IV. I think I might have taken a pill at one point, like swallowed something. Most were through IV. There was a shot. I know there was nerve blockers involved. I know there were antibiotics. I know there was like local anesthesia, and there was anesthesia through an IV. I was told that I wouldn't be completely under. So I wouldn't remember anything, but I wasn't completely under. They called it like twilight anesthesia. I don't know. I don't know. I did feel kind of relaxed before. I was so keyed up. It was nerve-wracking, but I knew it was in good hands. So they gave me something to kind of calm me down. I remember being in the little hospital bed, saying goodbye to my husband, and being rolled into the operating room. And I think that's the first time I've ever been like in an operating room, because I remember seeing like the big lights that you see on the TV. I remember my doctor saying hi to me just for a moment, and then I was out. Like, that's all I remember. The next thing I remember is that I woke up in a different hospital room. I was like asking, what happened? Is it over? Where am I? And they kept just saying to me over and over, it's over, it's done with. Well, one of the things I was really concerned about was, so this procedure, they had told me that I would either have glue, surgical glue, or stitches. Now, surgical glue meant that I would be able to take showers. I would be able to get it wet and take showers. Wouldn't be able to do baths, but take showers and basically live like normal until it healed. Stitches, I was told I had to keep them dry. So I would have like a pad on top of it, like a sticky pad on top of it, and I wouldn't be able to get wet at all, no showers. So I'd been praying for surgical glue. So when I woke up out of the anesthesia, one of the first things I asked was, did I have stitches or surgical glue? They told me surgical glue. Asked multiple times. My husband came in, they brought my husband in, he was there. I looked at him, I said, am I having stitches or surgical glue? He said, they told me surgical glue. And so I looked at the people again, the nurses again, who had brought me in, who were in the operating room. Did I have surgical glue or stitches? Surgical glue. Okay, so I was feeling tons of relief. I don't think I saw my doctor. They sent me home. Once I was awake and I had gone to the bathroom, they told my husband it was safe to take me home. So we had an hour-and-a-half drive back home. I slept in the entire way back home. Felt no pain. No pain whatsoever. They had me fill a prescription for, it was something really strong. I don't remember what it was. But days before the surgery, they had me fill a prescription at my local pharmacy for something really strong. Through my surgery, I didn't need it. They're like, you can take Tylenol, you can alternate between Tylenol and ibuprofen, or you can take this really strong medication, so you don't feel any pain. I never once felt pain. I mean, I felt like a little achiness, never once felt pain. Okay, so I get home and I see that I've got this big bandage on my arm. And they were like, when you get home, I think it was like a day after I was supposed to change it, and then I was supposed to change it a couple days after that. Well, so I didn't take a shower. I waited 2 days till I was supposed to switch the bandage, and I pulled the bandage off, and guess what I found underneath? It looked like stitches. Again, I had never had stitches before, but it looked like stitches, sure enough. So I called my doctor's office nurse line and said, hey, I was told I had surgical glue, but I think I'm looking at stitches. And so she looked up at the little chart. She said, no, you had surgical glue. And I'm like, but I'm seeing what looks like stitches. She said, hold on. So she went back and asked my surgical oncologist, and he said that they had started with surgical glue up here, but then they had to go so deep and take so much that they ended up closing with stitches. So that, for some reason, sent me over the edge. Tears, trauma, I could not handle that. I think that was the hardest part, was having this hope that I would be able to return to some sort of normal, and then told that I wouldn't be able to take a shower for, how many days was that? 3 weeks? So I could only take like sponge baths for 3 weeks. And for some people that wouldn't have been a big deal, but for me it meant that I couldn't be normal. I was also told I couldn't exercise, I couldn't get on the elliptical, I couldn't drive a car. Couldn't drive a car for 3 weeks. And some doctors will tell you differently. Some doctors don't care if you get stitches wet, but my doctor felt that dry stitches healed faster and reduced the risk of infection. So of course I'm going to follow my doctor's instructions. So the aftercare was easy on one hand in that I didn't feel any pain, just sort of like a toothache kind of, but not like a bad toothache, just kind of it's bothering me a little bit. And as you can see, it's healed up really nicely. I have been putting some scar reducing stuff on here. I might do a video if you're interested in knowing like what scar gel, what scar lotions, oils, silicone sheets. I've tried a bunch of stuff. If you've had melanoma skin cancer surgery, what kind of surgery did you have? Are you getting ready to go into surgery? I'm here for you. It is traumatic.